Since time immemorial, there have been a killer disease that has claimed lives for both the rich and the poor, and fans flame on both the old and the young. Pneumonia. James Brown was a popular jazz artist who died of pneumonia. And that leads us to the question, what exactly is pneumonia?
Pneumonia is the inflammation of the tissue of one or both lungs.
So air travels down the trachea through the bronchi and reach the alveoli, a one-cell thick lung tissue that allows gaseous exchange. Globally, about 450 million people suffer from pneumonia yearly. That's a huge percent of about 7% of the whole population, and out of the 450 million people, 4 million deaths are reported annually. The blue being the alveoli and the red being the blood vessel at the alveoli. What happens is this area is filled up with mucus, pus and white blood cells, thereafter inhibiting adequate oxygen and carbon dioxide perfusion in and out of the body. This results to low oxygen levels requiring oxygen supplementation. Some of the common symptoms of pneumonia include cough that is productive in nature, chest pain, especially when you breathe in or when you sneeze or when you cough, chills and fevers, nausea, vomiting, loss of appetite, among others. Pneumonia diagnosis is made based on the history of cough, fever, chills. A chest X-ray is very important in diagnosing pneumonia. It will show infiltration in the affected area with white shadows showing inflammatory alveoli process. A full hemogram or a complete blood count may be indicative of pneumonia infection in the case where we have elevated or reduced white blood cell counts. Culture and sensitivity of the coughed out sputum is also another very important way of diagnosing and finding the right cure for the organism causing the pneumonia. Apart from the chest X-ray, a bronchoscopy and a chest CT scan can also be a very, very important way of diagnosing pneumonia because it's going to show more details inside the lungs. Hypoxemia from pulse oximeter will also be very helpful to supporting our diagnosis of pneumonia. Pneumonia treatment is reliant upon the causative organism. As discussed earlier, the most common cause of pneumonia is bacterial infection, and it is widely treated using antibiotics. The choice of the best antibiotic is based on the symptoms you are presenting with, and I will expound further on the antibiotic treatment in some later videos. So make sure you subscribe, hit the notification bell so as not to miss out on the updates. So most of the outpatient pneumonia cases are treated with oral antibiotics and should respond in 3 days. But make sure you complete the full dose. So viral pneumonia is managed symptomatically. If you're having allergic sneezing or running nose, we're giving antihistamines such as cetirizine and chlorpheniramine to relieve the symptoms. It is also highly recommended to take a lot of warm water so as to remain hydrated. Pneumonia is very preventable by giving pneumococcal vaccine that is mostly given to infants and any other person in a different age group who is at risk of contracting pneumonia the most.